Do you get knee pain from arthritis? Does your knee start to have swelling or deformity? Do you hear any clicking or popping when you move? Are you worried about getting arthritis as you get over 50 years old? Hello everyone, I'm Zoe from Pain-Free Physiotherapy and Allied Health. Today I'm going to talk about knee osteoarthritis and tell you 5 strategies to avoid knee surgery and to be as active as you like. Knee osteoarthritis is a progressive degeneration of the knee joints. It involves breakdown of cartilage that acts as a cushion between the bones. If you always stand for a long time, kneeling, squatting, and bending your knees a lot, together with being overweight, you are more likely to get knee osteoarthritis when you get old. All these factors speed up the wear and tear of cartilage, and you will start to get deformity at the knee. As most of the cartilage is worn out, and we lose the cushion between the bones rub against each other when you move. This causes stiffness and pain at the affected knee joints. You are also likely to get other symptoms at the knee, such as swelling, reduced range of motion, buckling and locking, and clicking sound when you move. Your doctors may get you to do X-ray or MRI and tell you the findings of the imaging, such as narrowing of the joint space or thickening of the bone. They will then prescribe some pain or anti-inflammatory drugs to relieve the symptoms.